In this edition of Generations, we talk to Tina Yates from Eliza Huntington about assisted living versus residential care. Diana Ray from Apple Rehab Uncasville gives us the lowdown on picking the right rehab for you. And Judy Jenks from seniorcenterct.org talks about how technology is helping us in new ways. Hello, I'm Brian Scott Smith and welcome to Generations, a new podcast for people of your generation. We kick off the new year with a discussion about assisted living versus residential care and what exactly is the difference between them. I caught up with Tina Yates from Eliza Huntington Memorial Home of Norwich to find out more about the two types of service. Tina, thanks ever so much for joining us on Generations.
Thank you for having me.
So tell us a little bit about the difference between residential care, which is what your organisation is about, and assisted living.
So the residential care homes are mainly designed for people who are able to live independently, but would like assistance with some of the things that they may struggle with doing on a day-to-day basis at their own home. So, they don't have to cook their own meals. They don't have to do their own laundry. They don't have to, keep their home cleaned because there are individuals that do all of those tasks for them at residential care facilities. Our job is to make sure that, our ladies have their medications as they're needed, when they're directed, that they are given activities to keep, that we keep them busy with plenty of different items. We do not have any skilled nursing care. So that is one of the main differences. We do not have a nurse on staff. So if one of our residents is not feeling well, or they are ill, or they fall, we need to send them on to, their doctor or the emergency room to receive care. It's basically independent living with somebody that is taking care of your day-to-day needs for you.
Just to be clear then, so assisted living is also the medical part of it as well, which is what sort of gives us the variation between residential care and assisted living.
Most assisted living places have a nurse either on staff or on site that can, help with, if somebody needs their blood pressure taken or vital signs taken on a regular basis, or, injectables such as diabetes medicines. We cannot help or assist or do any blood draws or, utilize insulin for our residents.
So tell us a little bit more. Your facility in Norwich is a ladies only facility. Why that is, and what the ladies get out of living in a single sex sort of like residential care facility.
Well, so it came about that way as the founder, Eliza Huntington, when she was alive back in the 1800s, she was known to be a person who took care of many of the needy and indigent women in the population at the time. That was what her passion was. So when she passed away, her husband had stated that he wanted to continue that in, her name. So when he died, he left the home and its grounds and some initial funding to ensure that this passion of hers, if you will, was continued. And that's how this facility has been operating since Jedediah's death in 1872. So it's been maintained that way due to the fact that that's how the charter was written, and that's really what it was intended for, was a home for indigent women that needed assistance.
So when would you say, what advice can you give to people listening to this? When would a person need to make the decision, do you feel, to maybe leave their home and enter into something like a residential care facility?
Well, there's a lot of different variables, for sure, that go into it. But most of the time, it's when they've reached a personal point of, feeling like they're forgetting to do, significant things. They're not remembering whether they took their medication at the right time, or maybe they're making themselves a meal and they're not remembering to turn the stove off every time. Things that are not deal breakers for a lot of people, but they can be they can cause certain risks for them to be at home alone. Some of our residents have just reached a point where, they don't want to keep up the house by themselves anymore. They don't want to have to worry about it. They want a place to go where they are comfortable and they have other peers, their age group there. That's where I think our being an all women facility comes into play for a lot of our women. They enjoy the fact that it is all women and there's a comfort level there for them with that. We don't have really any kind of a separation for a male female population, so for our purposes it wouldn't really be a good fit. There are a lot of residential care homes that are men and women participants. They are, some are small, some are very large throughout Connecticut, and there's a lot of different reasons why, a lot of them don't have age limits. Ours is particularly set up for elderly women. So women have to be at least 60 years of age to be considered for, residents here. That is not the case with a lot of other residential care homes. There are different homes that have different populations. Some have a lot of mental health residents that are using their facilities. There are some that are all men. There are some that are all women. There are some that are a joint population, depending on the type of room settings that they have.
So I suppose the question to you is, when somebody is considering, to say maybe moving out of their home and considering either assisted living or residential care, they need to, one, asking a lot of questions of that particular facility, but also of themselves, as in, what is it that I need? But I'm guessing if they still have family, that's something that the family can also, be asking questions of them and, the facilities too.
Absolutely. And family plays a big role for us here at Eliza, with being that it's an all women's facility. A lot of the family does have a role in that. They bring them here usually for tours, and it gives them a certain amount of peace of mind as far as knowing that their mom or their aunt or their loved one is going to have a place that they're going to be well taken care of, where they can still be active. Our residents are free to come and go however they choose. If they want to go out and go to the store during the day, they can. If they want to go with their family for the weekend, they can. There's no restrictions on their comings and goings, as well as their visitors that they have here, which makes it a very comfortable level for the family. It gives them a great sense of security, knowing that they don't have to worry so much about their loved one and being home alone, or making sure that someone's checking in on them just on a day-to-day basis.
You are an administrator there at the facility. What do some of your ladies who live at the Eliza Memorial Residential Centre, what do they say to you about their living there and what they feel about the facility?
Well, most of our women that are here really do enjoy the fact that they don't have to worry about, their laundry. They don't have to worry about what they're going to make for meals, but they also very much enjoy the fact that their family can come and go. The holiday season is always, a really enjoyable time here for the ladies, with the holiday decorations and the different activities that they have, and the people coming in to visit and sing and perform for them. It gives them a real positive feel for where they are living at the time. And for them to be able to have people come in. I tell you how many people have come in to visit and to look at the decorations and sit down in the parlor room with the ladies as they visit and just enjoy coming in to see them and just make those holidays a little bit more special for them.
Our thanks to Tina, and if you want to find out more about the service of her agency, you can visit their website at elizahuntington.com. Accidents and injury can befall any of us at any age, and if you have surgery and need rehab afterwards, where exactly should you go, and how do you pick the right rehab facility for your needs? Dinah Ray is the director of rehab at Apple Rehab in Uncasville, part of the wider Apple Rehab organisation in Connecticut and Rhode Island. Dinah, thanks for joining us on Generations. So let's delve into, obviously, rehab as against, clearly staying at home. If you are involved in an accident or maybe you have surgery and, you need to get back on your feet, as it were, what's the benefit of having rehab at a rehab centre rather than staying at home and trying to go it alone?
One of the main advantages of being in a rehab center is that you'd receive therapy many more times per week than you would when you were at staying at home. During home care, usually you can think about, on average, somewhere around 2 to 3 times per week. Whereas in a rehab facility, you will definitely be getting therapy normally between 6 and 7 times per week.
And, talk us through, how does somebody work out, because there's lots of rehab organisations out there, how does one work out where they go to get their rehab?
Sure. One of the first things I think for anyone to consider is, what is your insurance going to cover? You want to make sure that it's a facility that is accepted by your insurance. You don't want to end up with insurmountable bills for this activity. Another thing that you want to consider is how often are they going to give you therapy? Will it be 5 days a week? It should be 6 to 7 days a week. That would be the norm, I would say. If you have the opportunity, if you have a planned surgery, and you have the opportunity, of course, I would always say visit the facilities. There's a lot of facilities in our area, and they all have something to offer. So visit the facility, find out what's your first impression when you walk through the door. Does it feel comfortable? Does it look inviting? Are people friendly? Ask for a tour. If they're reluctant to give you a tour, then that would be a good indicator. But most places are going to be more than happy to let you see their rooms, their dining room, their rehab center. Those are big things. The other thing is to be able to speak with a therapist if you can. Ask the questions. Are they familiar with the surgery that you're having planned? Are they comfortable with it? How many therapists are full-time in that department, or do they have a lot of people that come and go? Another good thing to think about is there a big turnover? How long have therapists been in that facility? Do they change often, or are they pretty consistent? Also, when you're being treated, what type of consistency could you expect? Will you see a different therapist every day, or will you be seen by 1 or 2 specific therapists during your stay?
Let's talk about the insurance aspect, because I know this is very important, and we sort of spoke about this a little bit before the interview. Insurance, what do you need to be checking for? Any sort of rehab, any sort of therapy is costly.
Okay, some of the major issues are, 1, is your insurance participating with that facility? If they're not participating and it's going to be an out-of-network issue, that could incur more expenses. Do they require a number of days to be in the hospital? As with Medicare, usually you have to have a 3-day qualifying stay that you're inpatient, which is a big keyword. If you're not inpatient, then you haven't had a qualifying stay. And your insurance will not always cover your entire bill.
Why should people come to Apple Rehab?
One of the nice things about Apple Rehab is there's a lot of locations. So there is a good chance that there is going to be a location very nearby you. which makes it nice. Family can come and visit and help participate if you need to with the therapy, or get home training if you need it. Another nice thing is that they do specialize. Some facilities do specialize in pulmonary or cardiac rehab if that's what you need. Otherwise, they're very capable of treating most other illnesses or diagnoses.
You are across Connecticut and also Rhode Island. So I guess that makes you maybe a more favoured like rehab type of organisation, because when you're having rehab, I suppose you really don't want to be travelling too far if you've just
Correct.
had surgery, etc. So it sounds like, you're across the state. So probably within about, 15, 20 miles, I'm guessing that you've probably got an Apple facility near you.
Absolutely, absolutely. In this area we have, of course, Westerly. Then we also have Mystic, Norwich, Colchester, which pretty much gets this whole side of Connecticut. There's also all across right over to the western part of the state.
And you also mentioned about, having specialists as well as all the facilities having general therapy as well.
Yes.
That sounds like a real plus point, because I guess, it's nice to know that if you have had a pulmonary issue, Apple can say to you, hey, look, we can deal with you here, but actually we've got some specialists just down the road. So
Exactly.
do you think that helps people, feel a little bit more confident when they're picking an organisation like Apple? It's like, I know I can get my general treatment, but also there's these specialists as well. Is that important to people?
I think it's important, and I think it's also important that, say you went to our facility in Uncasville and questioned, and we felt that we could serve you better in another area, we would recommend that you go to the correct facility so that you're not just thrown into something that may not be to your best advantage.
So that's a real nice plus point, is that you've got the power of your network to be able to say to people, hey, we'd love to deal with you, but in fact we've got some even better specialists down the road.
It is, exactly. I think another nice thing with Apple is that there's constantly training. They support the therapists in being trained for many different things, for different diagnoses, for different treatments, and we're always going to different seminars, continuing education programs, so that we can all further our knowledge base.
And also, I suppose it's important not just for the person who's going to undergo the rehab, but also the family as well, to know that they're going to a facility that's experienced, got great professionals, is again maybe close by to them, but they can can the family visit obviously that family member if they're at the rehab?
Absolutely. They're always welcome to come in to visit after normal hours. Our doors they may be locked at times, but they're always welcome to come in, even if it's 11 o'clock at night. As long as they're not disturbing other residents, it shouldn't be an issue. Watching rehab, as long as the patient is okay with it, we're more than happy to have family members come in. They can watch what's going on. They can participate. We offer caregiver training with everyone that we see. We also offer home assessments, so we can go right into your home, check it out, see what you need, what recommendations we can make to make your return to your home environment the best that it can be.
Tell us a little bit more about your facility. What do people think about it?
Well, I like to think that people are happy with us. People that come from rehab, usually if they have another issue or they have a family member that needs therapy, they return. We offer 7-day-a-week therapy. No questions, no exclusions. If you come, I'm going to make sure that the schedule is such that you would receive therapy every single day of your stay. It doesn't matter what your payer is. That's the way you're going to get better faster.
So what sort of things do people generally say to you guys at Apple Rehab in Uncasville after they've had obviously an experience there?
Most of the time I hear that, of course I want to say that they love the therapists, but they love the nursing staff, they love the CNAs, they feel that they're very attentive to their needs. There's going to be always a time when something may not be exactly what they expect, but on the whole, all our reviews have been extremely happy with their stays.
The final point to make about rehab is if you're going to get better, after a surgery or an accident, do go to rehab. Don't, as I say, try going it alone or whatever, because having this support mechanism is really the most important thing that maybe some people just don't realise they need it.
Definitely. If you are in the hospital and you need help getting out of bed, you need help getting to the bathroom, you need help getting your clothes on, you are concerned, how am I going to get in and out of my house? You need to go to rehab. It may only be for a few days, it could be for a week, 2 weeks, but you'll get more therapy, and when you do go home, you're going to walk through that door and you're going to feel comfortable. I'm ready to do this.
My thanks to Diana, and you can find out more about Apple's various rehab facilities at their website, apple-rehab.com. And finally, Judy Jenks from Senior Centre CT.org is with us for the first chat of 2019. Welcome, Judy, and Happy New Year to you.
Happy New Year to you, and welcome back from Iceland, where you spent Christmas.
I did indeed.
Yes, wonderful.
So, Judy, we are talking about how technology is helping us in new ways. This is a fascinating subject.
Yes, and we all want to stay home as long as we can, and we're discovering with new technology, it can assist us in ways we never imagined. At every age, we want to feel safe and independent. And as we age, those around us become more and more concerned about our well-being. With today's technology, there are devices that can help us know what's going on around us, monitor what we're doing, and learn from us and help us. Doorbells. Now they have doorbells that have Wi-Fi cameras, so you can hook up your smartphone and know who's at the door and even talk to whoever's out there. Thermostats can be programmed, hooked up to your Wi-Fi. They can learn when you're home, when you're away, adjust the temperature, and you can also use your smartphone to adjust the thermostat, whether you're home or you're not home. Smartphones, they do a huge number of tasks, from making phone calls, storing information, reminding you to do any number of things. They have calendars, timers, alarms, calculators, cameras, and a whole lot more. A smartphone is actually a full-fledged computer that you put in your pocket, and you can connect them to any number of devices using Wi-Fi. Home security systems. Smart sensors and security cameras can be set up indoors and outdoors. With Wi-Fi, we can see if anyone or anything is out there. My motion detector lights will go on, and I'm always like, what's out there? Is it a deer or what is it? And you can use them indoors. People are starting to use them to monitor loved ones. Are they okay? Are they up and about? They can track activity, the refrigerator door, the medicine cabinet, and some of these home security systems, you can actually even talk to them too. Then we have the smart speakers. We've talked about those a little bit, and they're great because they respond to your voice. You can ask them, what time is it, play the Beatles, what's the joke of the day, or ask them any question. And of course, the speaker is not going to always know the answer. But the speaker can remind you to take your meds, about appointments, and a whole bunch of other things. Then we have the simple timers. You can put it on a living room light, and then every evening and again in the morning, the light comes on. Those passing by thinks that somebody's home, whether there is or there isn't anyone in the house. And then we can use the light so that it's light when we get up, and when we go to bed, and it will reduce the chance of tripping. And then smart TVs, who knew? I can now talk to my TV. I don't even need to know what channel the show is on. I just ask it for whatever I want to see. Let's say I want to say Patriots game, and it will show me what it is, and boom, I don't even need to know the channel. The TV also shows me who's calling on my phone before the phone even rings. Then we have the emergency pendants. We all remember the commercial, I've fallen and can't get up. Now they can even detect falls, which is amazing. So if you happen to fall and you have the emergency pendant with that, it will contact the company that you have fallen. And of course, we can activate those devices ourselves, tell whoever's monitoring what has happened, and they will send help. The tracking chips. Now they have tracking chips that you can attach to the dog's collar so you know where he ran off to. You can put it on your key ring so you can find your keys when you don't know where they are. And then you also could put it in your loved one's pocket so if they're starting to wander, maybe they have Alzheimer's, you can find them if they get lost. Also, we can even attach them to that person's smartphone, their emergency pendant, their key ring, and then hopefully they have it with them at all times and we don't need to worry so much that they've gotten lost. Then they also have smart pill boxes. They have medicine reminders and dispensers. They notify the smartphone if you've forgotten to take your pills or if you took the wrong ones, and who doesn't forget to take their pills from time to time? Now, I might need some of these things. Why might I need them? To be safe and feel safe, to be able to get help if I need help, and to be independent, which is what we all want. So that's not such bad things. And now let's reassess how we feel about all of this.
How do you feel about it? Because every generation grows up with different things.
Right.
Now, it's no mystery. You're a little bit older than me, but you're very much into your technology.
Yes,
but not everybody is. Even in my age group, not everyone's into their technology. So how do you feel about all of this?
I think that we can be smart about it. So what are the things that are going to help us? And so for me in particular, I get very distracted. I don't always know what time it is, so I need a device to tell me. And I had a device tell me to come and meet with you, because otherwise I probably wouldn't have been here on time. So as far as the pill reminders, that's excellent. I've got a little system now so that they're in the same place. When I get my coffee, I take my pills. But when I go on vacation, to use it when I'm on vacation is a really good thing, because I do forget. The security system and knowing what's going on and the monitoring, whatever, that's not a bad thing at all. My smartphone, I don't think I could live without my smartphone.
It's amazing, isn't it, since that they've come along, that we say that. But in all honesty, they do so much for us now. I mean, I was reading something because, in my home, I've got like Alexas and Google Assistants all over the place. And I was reading something the other day that Alexa has got a security feature now. You have to set it up, but you can basically say, Alexa, I'm leaving. And once you've set it up, Alexa will use the microphones inside all of the Alexas and listen out to see if it hears glass being broken, if somebody breaks into your house. And if it does, it sends you an alert to say, I've detected something, and then you can, what they call, drop in, and you can listen in real time and hear if something's going on in your house. And then obviously you can take the appropriate action. So, all of this technology is just, finding amazing ways to help us with our lives. Judy, I have to, of course, ask you, have you been using your potato timer on your... Because we do mention this occasionally.
Right. So what happened was I got the smart TV, and then I switched over my cable company, my provider, and it disconnected my Alexa. So she now tells me that she needs to be reprogrammed. And in my attempt to reprogram her, I unregistered her. So now I need to register her and then hook her up to the new Wi-Fi address. So I have not used her, but she has been nagging me.
Okay, sounds like there's burnt potatoes going on in the Jenks household. Judy, as always, thank you.
Thank you.
That's all from this edition of Generations. Don't forget to visit seniorcenterct.org to find out what's going on in your neck of the woods. And if you want to send us a topic to talk about or want to be our guest on the podcast, drop us a line by visiting the seniorcenterct.org website. Go to the bottom of the homepage and click the How to Advertise with Us link to get in touch. From myself, Brian Scott Smith, thanks for listening. We'll catch you next time.